Understanding the difference between skilled nursing rehab versus inpatient rehab. Have you heard of inpatient rehab facilities or skilled nursing rehab facilities? These terms get confusing because in a hospital, they're generally lumped into one term, rehab. It's not uncommon for doctors, therapists, case managers, or nurses to say, you or your loved one need to go to rehab. Technically, inpatient rehab and skilled nursing rehab are very different. Now let's discuss those differences. Skilled nursing rehab, or referred to as subacute rehab, is a type of facility where skilled nursing care is provided 24 hours a day, 7 days a week. And therapy services are provided 5 to 7 days a week. Most residents go to this type of rehab receive between 1 and 2 hours of therapy a day. The therapy can include physical therapy, occupational therapy, and speech therapy. It can include one or all three practices. The length of stay for a skilled nursing rehab averages of between 2 weeks and 2 months. However, Medicare recipients can have up to 100 days. Now the key term there is up to. It doesn't guarantee you get 100 days. It just means you have the ability, as long as you're showing progress, to receive up to 100 days after a qualifying hospital stay. Insurance plans such as Medicare will pay for skilled rehab following certain requirements. For Medicare, you have to meet a 3 consecutive midnight stay in a hospital. That means you have to have been inpatient status admitted for 3 overnight midnight stays. Then the rehab is covered. Now, sometimes you'll have an outpatient procedure where you do not meet that criteria. You can still receive the skilled nursing rehab, but it's going to have to be paid for out of pocket. Now, inpatient rehab or acute rehab differs. They still have that skilled nursing component, but they primarily focus on the therapy service that they offer. Inpatient rehab requires participants to do at least 3 hours minimum therapy a day. Therapy often includes physical therapy, occupational therapy, and speech therapy. But it really depends on the patient's specific needs as to which therapies or all therapies they receive. Inpatient stays are often shorter than skilled nursing rehab. They average around 10 days. There are many factors that play into this time frame of stay and depend on medical diagnosis and functional limitations. Insurance often covers this form of rehab under certain conditions. For Medicare, those conditions break down to 3 key components. 1, there has to be a 3-hour daily requirement for therapy being met. So the participant has to be able to physically maneuver and do 3 hours of therapy a day. They also have to show during that therapy measurable and functional improvement day after day to continue to remain at that subacute or the acute level. There also has to be a qualifying diagnosis that's met. If you are wondering which rehab level is appropriate for you, consult with your doctor, physician, nurse, care manager, or therapy team to best talk about your specific needs or your loved one's needs and which service might be best for them. Remember, you can also pair the two. Many people start out in acute rehab and then go to subacute, or vice versa. Maybe they can't do the 3 hours beginning and they'll start at subacute and then they'll go to acute. Keep in mind there are many different styles of rehab that we have not discussed in this series. Tune in for another video on the type of rehab that might be best for you and understanding the type of senior related services that are available for your loved one.